Hey guys, Tim here. Welcome back to our Abdominal Sonography Registry review. Let's keep rocking this test. Question 25. Click on the FNH or the focal nodular hyperplasia lesion. Where on this image is the focal nodular hyperplasia lesion? The answer is right here, this little guy. Question 26. This type of mass is known to secrete epinephrine and norepinephrine and is associated with von Hippel-Lindau disease. What type of mass is this? A. Renal cell carcinoma. B. Hepatoblastoma. C. Pheochromocytoma. Or D. Hepatic lipoma. The answer is C. Pheochromocytoma. Question 27. What type of artifacts are these liver tumors known for creating? A. Posterior enhancement. B. Speed error. C. Posterior shadowing. Or D. Mirror imaging. The answer is B, speed error artifact. So this is called a hepatic lipoma. You can see in this frame here, there's a little bit of a displacement of the diaphragm. What happens is pulses will come down from the transducer into the body and travel at a speed of 1540 meters per second in soft tissue. However, once it hits this hepatic lipoma, the speed of ultrasound will slow down and the image or that echo will be displaced deeper in the tissue. So that's why you have a break in this diaphragm. Question 28. This type of tumor is capable of invading the portal veins, hepatic veins, and IVC, and is commonly found in patients with cirrhosis. What type of tumor is this? A. Renal cell carcinoma. B. Hepatoblastoma. C. Metastatic disease. Or D. Hepatocellular carcinoma. The answer is D, hepatocellular carcinoma. Question 29. Which of the following is performed first after discovering this condition? A, radiation therapy. B, chemotherapy. C, biopsy. Or D, emergent surgery. The answer is C, biopsy. It turns out that this patient had metastatic disease. The first step in identifying any type of tumor is a biopsy. Question 30. What sonographic finding below is associated with this finding? A, increased RI or resistive index. B, dilated renal artery. C, hydronephrosis. Or D, renal enlargement. This patient here has a left renal vein thrombus, which will cause increased resistive index in the renal arteries. So the answer is A. Question 31. This type of finding is most commonly found with A, dilated renal collecting systems, B, complete ureteral duplication, C, bladder neoplasms, or D, benign prostatic hypertrophy. So this patient has a condition called ureterocele, and this is a common finding in patients who have a complete ureteral duplication. Question 32. Which of the following is the most common clinical presentation with this condition? A, hematuria, B, incontinence, C, urinary retention, or D, proteinuria? The answer is A, hematuria. This patient here has transitional cell carcinoma of the bladder. Question 33. Failure to depict a normal kidney associated with this condition is known as what? A, acute pyelonephritis, B, pyelonephrosis, C, XGPN or xanthogranulopyelonephritis, or D, emphysematous pyelonephritis. The answer is C, XGPN or xanthogranulopyelonephritis. This ultrasound represents a staghorn calculus, and failure to depict a normal kidney associated with staghorn calculus will suggest a diagnosis of XGPN or xanthogranulopyelonephritis. Question 34. A 65-year-old male presents to the emergency room complaining of not feeling well. The patient is febrile with a high white blood cell count. Based on this ultrasound, what does this patient have? A, acute pyelonephritis, B, pyelonephrosis, C, acute kidney injury, or D, acute tubular necrosis? The answer is B, pyelonephrosis. Question 35. A patient arrives to the hospital to undergo surgery. 3 days after recovery, the patient becomes septic, but makes a full recovery and is discharged a week later. About 24 hours later, the patient returns to the hospital complaining of nausea, vomiting, and swelling. Based on this ultrasound, what is going on? A, autosomal dominant polycystic kidney disease, B, acute glomerulonephritis, C, hydronephrosis, or D, acute tubular necrosis? The answer is D, acute tubular necrosis. Question 36. This patient has a sudden onset of uncontrollable hypertension and bilateral lower extremity edema. The physician orders a kidney sonogram and you see this. What does this ultrasound show? A. Renal artery stenosis. B. Abdominal aortic aneurysm. C. Abdominal dissection. Or D. Abdominal pseudoaneurysm. The answer is A. Renal artery stenosis. Question 37. This ultrasound represents a type of testicle more commonly found in the inguinal canal and increases the chances of developing malignancy. What does this ultrasound show? A. Spermatoceles. B. Epididymitis. C. Testicular torsion. Or D. Cryptocortism. The answer is D. Cryptocortism. Question 38. This type of kidney tumor must prove the destruction of the renal contour before it can be called what? A. Nephroblastoma. B. Neuroblastoma. C. Mesoblastic nephroma. Or D. Renal oncocytoma. Now, this image or ultrasound is not the most optimal quality. However, on your boards, you can expect to have images or videos that will be super crystal clear. The answer to this question is a nephroblastoma or a Wilms tumor. Question 39. Which of the following describes this ultrasound of a patient who has a history of intestinal malrotation with both biliary and renal atresia? A. Tuberous sclerosis. B. Left isomerism. C. Right isomerism. Or D. Caroli syndrome. The answer is B. Left isomerism. This ultrasound represents multiple spleens, which is something you can expect to see with someone who has polysplenia. Question 40. Which of the following below best explains this hepatic vein waveform presentation? A. Merizzi syndrome. B. Sjogren syndrome. C. Budd-Chiari syndrome. Or D. May-Thurner syndrome. The answer is C. Budd-Chiari syndrome. What this does is it'll obstruct the hepatic vein and will cause the venous flow to flow retrograde or hepatopedal. Question 41. What is responsible for the production of epinephrine and norepinephrine, as well as vasoconstriction and promotion of glycogenolysis? A. Renal sinus. B. Renal cortex. C. Adrenal cortex. Or D. Adrenal medulla. The answer is D. Adrenal medulla. Question 42. What type of waveform does this represent? A. Low resistance, high velocity. B. High resistance, high velocity. C. High resistance, low velocity. Or D. Low resistance, low velocity. The answer is A. Low resistance, high velocity. Question 43. Where can the duct of Wirsung be located on ultrasound? A. Pancreatic head and body. B. Between the pancreas and the duodenum. C. Medial border of the liver. Or D. Extending from the gallbladder to the CBD or the common bile duct. The answer is A. Pancreatic head and body. Question 44. This Doppler ultrasound of the kidney shows what? A. Renal artery stenosis. B. Renal vein thrombus. C. Renal arteriovenous shunt. Or D. Increased resistive index. The answer is C. Renal arteriovenous shunt. Question 45. Which artery travels superiorly toward the liver, anteriorly to the portal vein, and left of the bile duct? A. Proper hepatic artery. B. Common hepatic artery. C. Right gastric artery. Or D. Gastroduodenal artery. The answer is A. Proper hepatic artery. Question 46. Click on the ligamentum venosum. Where in this image is the ligamentum venosum? The answer is right here, that line. Question 47. What does this ultrasound show? A. Cystitis. B. Ureterocele. C. Urachal cyst. Or D. Bladder diverticulum. One last look at the image here. And the answer is D. Bladder diverticulum. Question 48. Non-invasive diagnosis of renal artery stenosis. A. Can be made by B-mode images of atherosclerotic plaque. B, not the most recommended since the renal arteries are too deep for ultrasound penetration to provide optimal imaging. C, requires a duplex system with spectral signal analysis. Or D, can be accomplished with a non-duplex Doppler system. The answer to this question is C. It requires a duplex system with spectral signal analysis. So this animation here actually is not going to help you with this question. Be careful on your exam of distractors. So you will have words that won't make sense. You might have images or videos that will distract you. If something doesn't make sense, ignore it and then just focus on the question. Question 49. This patient who has a history of portal hypertension and polycystic kidney disease also has what based on this ultrasound? A, choledochal cysts. B, primary sclerosing cholangitis. C, pancreatic adenocarcinoma. Or D, Caroli disease. The answer is D, Caroli disease. Question 50. Click on the crust of the diaphragm. If you had this image on your boards, where would you click on the crust of the diaphragm? The answer is right here, this hypoechoic area. Well, that completes our next 25 questions of this abdominal sonography registry review. I'll hurry and write 25 more questions and upload that video as soon as I can. I'm Jim with ultrasoundboardreview.com. Thank you so much for watching.